When you're depressed, where do you want to go? Nowhere. Who do you feel like seeing? No one. Depression hurts in so many ways. Sadness, loss of interest, anxiety.
Bright lights and city sounds are ringing like a drone. Unknown.
With over 350 million people affected by depression worldwide, it's no doubt an incredibly real and serious issue.
Most days I can put on a brave face and muddle through, but other days I still struggle with my depression.
There's empty hearts, buying happy from shopping carts. Nothing but time to kill, sip life from bottles. Tired skin bodyguards, Gucci down the boulevard. Cocaine dollar bills and
You may feel exhausted, hopeless, and anxious.
Cymbalta can help. I talked to my doctor. He said adding Abilify to my antidepressant could help with my depression.
my happy little pill. Take me away, dry my eyes, bring color to my skies, my sweet little pill. Take my hunger, lie within, numb my skin.
And I could feel a significant improvement in my
In
breathing.
the past, depression was often described as simply a chemical imbalance in the brain. Specifically, scientists believed that a lack of the neurotransmitter serotonin was to blame, which is often referred to as the feel-good chemical.
If you have depression, you may have a serotonin imbalance. Your overall level of serotonin may be low, and some of it may be reabsorbed too soon. As a result, communication between the brain cells is impaired. An SSRI, or selective serotonin reuptake inhibitor, is a medication designed to help increase the amount of serotonin in the synapse by blocking its reabsorption. As serotonin builds up, normal communication between cells can resume, and your symptoms of depression may improve.
Depression is not a serotonin deficiency. As somebody who writes and lectures about inflammatory and nutrient-driven models of depression, it surprises me to learn how much of the population believes that serotonin deficiency causes depression.
Now, you've all heard of the placebo effect before.
Afloat, sweating conversations seep into my bones.
That by believing and expecting something to work, it actually does. But what's weird is that the strength of the effect can differ for some really strange reasons. Saying a placebo will reduce pain reduces pain, but saying that the same placebo will increase pain increases pain. Believing that a placebo will make you feel better will make you feel better. Believing that it won't has the opposite effect. Now, placebos aren't just pills. They can be creams, injections, surgeries, or drinks. You can even get placebo buttons. They don't actually do anything, but they sure as hell make you feel like you're in control. But not all placebos are equal. The effect of the placebo is bigger when the pill itself is bigger. Or if you have 2 instead of 1. Or 2 once a day instead of 1 twice a day. And a capsule will usually beat a pill. And a syringe will usually beat a capsule. And anything with a big ass science machine can outperform any of them. A plain pill works worse than a branded one. A discounted pill works worse than a pricey one. And even a pill in a plain box does worse than one that's all shiny and shit. Placebos that are blue work best as downers. And placebos that are red are better as uppers. Studies have shown that people who take their meds on a regular basis are less likely to die than those that don't, even if those meds are all placebos. You can even get addicted to placebos. In one study, a group of women took placebos for more than 5 years. 40% of them suffered withdrawals afterwards. In fact, the effect of placebos can be so strong that some people want them banned from sports. But I mean, how would you even test for that? Placebos don't even seem to work from place to place. For example, in Germany, using a placebo to treat ulcers works better than anywhere else in Europe. But using a placebo that treats hypertension doesn't work nearly as well as it does for its neighbours. Now, remember that all of this is about comparing things that both have nothing medically effective in them, which goes to show that a placebo isn't about what's in it, but about the beliefs that we load onto it. Our minds create the medicine, and that is pretty freaking weird.
The drugs that we now consider antidepressants were discovered by accident. They were drugs that were used for the treatment of tuberculosis, and somebody noticed that some tubercular patients felt better when they took the drugs, and they said, oh, maybe this is an antidepressant. But they decided that without doing clinical trials that were placebo-controlled, and it turned out that placebos will do the exact.
Fools are not enough. I'll take a dip into the unknown. Glazed eyes, empty hearts, buying happy from shopping carts. Nothing but time to kill, sipping life from bottles. Tight skin bodyguards, put you down the boulevard. Cocaine, dollar bills, and
Cymbalta is a prescription medication that treats many symptoms of depression. Tell your doctor right away if your depression worsens, you have unusual changes in behavior, or thoughts of suicide. Antidepressants can increase these in children, teens, and young adults. Cymbalta is not approved for children under 18. People taking MAOIs or thyroidazine or with uncontrolled glaucoma should not take Cymbalta. Taking it with NSAID pain relievers, aspirin, or blood thinners may increase bleeding risk. Severe liver problems, some fatal, were reported. Signs include abdominal pain and yellowing of the skin or eyes. Talk with your doctor about your medicines, including those for migraine, or if you have high fever, confusion, and stiff muscles, to address a possible life-threatening condition. Tell your doctor about alcohol use, liver disease, and before you reduce or stop taking Cymbalta. Dizziness or fainting may occur upon standing. Side effects include nausea, dry mouth, and constipation. Ask your doctor about Cymbalta. Depression hurts. Cymbalta can help.
my happy little pill.